So anyway, cutting long story short, there are no laboratories available. We got the x-ray, then 24 hours later, everything was normal and so forth, cutting. But if there is a problem, very same thing, if I'd insisted, no, I want Moni to go to the emergency room, they would have agreed. They would have called ambulance. They would have taken her to the emergency room. All the tests would have been done, x-ray and so forth. Everything's normal. Go back. $2,000 of the ambulance I had to pay from the pocket. Plus other, I don't know what other things. These are the realities of life. Things are not that easy.
And Medicare doesn't even pay for that?
That's what I mentioned. Ambulance will not pay.
Oh, no. I was talking about x-rays.
Oh, that part we did not go through. They will pay. They will pay. But how much they will pay, I have no idea. But they will pay with supplemental, and they will pay everything. Medical care aspect, they will pay.
Yeah.
Doctors, we know that portion which I already covered. But I'm saying these are the reality. If I was not a doctor, then things would not. The other reality brings tears to my eyes. 80% of residents, they don't see their family, relatives, even once a week. Nursing staff, I talk to aides who go to rooms every time. They say, they don't come. Sometimes, rarely, they visit. Isn't it amazing? I'm sure they are Medicaid patients, but irrespective, they don't visit. No, I'm fine. Thank you. In our wing, we are 2 relatives who come every day. Out of 20, 25 rooms, 10 rooms at least. Oh, more than 15 rooms, 30 residents. Isn't it a shame that they are there just to finish their life? One time somebody, I don't know, in this group or other person asked me about rehab. Just like emergency room is the gateway to the hospital, rehab is the gateway to the nursing home. Every nursing home has got rehab. Good or bad, that is a different point. Because that is how they get the patients. They may not have subacute care. Subacute care is different. And the South Side, I hope none of us have to use it, is Candid Hospital. We have used 3 times, I think. So, every place nice. And now they are becoming so rich. I think we had in the papers, one of the representatives from our House Assembly acquired some whatever benefits in nursing homes and so forth. I forget the name from Kokomo. I think what I'll do is I'll stop here, open up for discussions or any more questions. Let me finish one more thing about, is there any federal or state help for myself or people like me? Answer is yes or no. Rules are very strict. And what we heard last month, we have to get expert legal advice who can guide us. How should we plan? That is why I mentioned long-term planning. And any gift that you have given to your children or grandchildren, give it away, your ownership, to your children. Don't keep under your name or your spouse's name, because that is counted as your asset. There are very strict regulations. Your assets have to be less than 30,000, not counting home and car. So that's a brief. I will stop here and open for discussions or questions.
Dr. Ahuja, thank you very much for excellent presentation and insight. And I just want to welcome a couple of ladies. Mr. Dave had mentioned to me that you would be joining us, so welcome, and we welcome you. And hopefully you found this informative, and we would in the near future give you platform to share your insights, and I know you have brought some insights for us. And Anjanaji has been walking through many versions of this difficult issue, so someday we would give you the platform as well. And I would let everybody ask questions if you have, and then I'll share some insights with everybody.
Yeah.
One at a time, please, and raise your hand.
I heard the last sentence that if your assets are under $30,000, then you would be on Medicaid.
I don't know what is the name of the program, but you can get federal combined, I think it's combined state and federal assistance.
So basically, then you will get the treatment regardless of.
Yeah, that has nothing to do with the treatment, provided that nursing home accepts that one.
Provided. So nursing homes in the state of Indiana will have to be under the same provision of federal regulations, rules, and state regulations. How can one nursing home can be different from others?
No, they're not different, but the nursing home can say, I don't accept Medicaid.
Okay.
Just like doctor's
Right,
office,
right.
I don't accept Medicaid, I don't accept Medicare.
I'll ask you one more question, then
Sure.
I'll ask you. You've been to London for many years. You have seen India a lot, and you have know this. Can you give your brief analysis or thoughts as to how do you compare with the Obamacare package presently available with what's happening in London or European countries where we are?
I think the Obamacare is something different. I did not talk anything about Obamacare.
I know.
See, the Obamacare, I never paid attention very much mainly because it is a disaster. Reason being, there are not enough physicians, there are not enough nurses,